What happens when the arteries that supply blood to your heart become blocked? When medicines and stents are no longer enough, doctors perform a life-saving procedure called heart bypass surgery, also known as Coronary Artery Bypass Grafting, or CABG. In this video, we will explain exactly how heart bypass surgery is done step by step using medical animation. This content is for educational purposes only. The heart is a powerful muscle that needs a constant supply of oxygen-rich blood to keep working properly. This blood reaches the heart through small vessels called coronary arteries. Over time, fat, cholesterol, and calcium can build up inside these arteries. This buildup is known as plaque. As plaque increases, the arteries become narrow and stiff, reducing blood flow to the heart muscle. When blood flow becomes too low, the heart does not receive enough oxygen, which can cause chest pain, heart damage, or even a heart attack. When one or more coronary arteries are severely blocked, doctors may recommend bypass surgery. Instead of removing the blockage, surgeons create a new pathway for blood to reach the heart. This new pathway allows blood to flow around the blocked area, which is why the procedure is called a bypass. Before the surgery begins, the patient is given general anesthesia. This means the patient is completely asleep and feels no pain during the operation. The surgical area is carefully cleaned and sterilized, and the patient is connected to monitors that track heart rate, blood pressure, and oxygen levels throughout the procedure. To reach the heart, the surgeon makes an incision along the center of the chest. The breastbone, also called the sternum, is carefully opened to expose the heart. Although this step may seem intense, it is a standard and controlled part of open heart surgery performed by highly trained specialists. In many bypass surgeries, the heart is temporarily stopped. The patient is connected to a heart-lung machine, which takes over the job of pumping blood and supplying oxygen to the body. This allows surgeons to work on the heart safely and with great precision. Next, the surgeon prepares a healthy blood vessel to use as the bypass graft. This vessel is usually taken from the leg, known as the saphenous vein, or from the chest wall, known as the internal mammary artery. These blood vessels are strong and suitable for creating a new route for blood flow. The surgeon then attaches one end of the graft to a large artery such as the aorta. The other end is connected to the coronary artery beyond the blocked section. This creates a new path that allows blood to flow freely to the heart muscle, bypassing the blockage completely. If multiple arteries are blocked, more than one bypass graft may be placed. Once all the bypass grafts are in position, the heart is gently restarted. The heart-lung machine is gradually removed, and doctors carefully check that blood is flowing properly through the new bypass vessels. The heart now receives improved blood supply and oxygen. After the surgery is complete, the breastbone is closed using surgical wires, and the chest incision is carefully sutured. The patient is then moved to the intensive care unit, where recovery begins under close medical supervision. Most patients spend 1 to 2 days in the ICU, followed by several more days in the hospital. Over the next few weeks, the chest bone heals and the heart continues to function with improved blood flow. With proper medication, lifestyle changes, and follow-up care, many patients are able to return to a normal and active life. Heart bypass surgery is a complex but highly effective procedure that has saved millions of lives around the world. By restoring blood flow to the heart, it helps reduce symptoms, improve quality of life, and lower the risk of future heart attacks. This video is intended for educational purposes only. Always consult a qualified medical professional for diagnosis and treatment.